So thank you, first of all, for coming. This is really wonderful to see this many people who are interested in climate and health and sustainable healthcare. I have a lot of familiar faces out there, as well as new people who I can't wait to get to know you better. So I'm an anesthesiologist, I'm an ICU doctor, and that's really my paycheck. But mostly what I do is sustainable healthcare at this point. I'm always looking to try to understand how we can take this giant behemoth of a system that we have and make it work better for us, both efficiency and elimination of waste. I put this up here just to demonstrate the size of the beast that we're dealing with right now. So the US healthcare system is about 18% of US GDP. So we're talking about health sector here. So pharmaceuticals, medical devices, insurance, et cetera, all is in there, but it's about 18%. So 18% of the US economy is dedicated to what we're talking about. And the vast majority of these resources are going to run through health systems. So health systems are, for many instances, the customer that this sector exists for. So we in the health systems have a lot of power if we use it appropriately. This behemoth has essentially gotten fat, I guess is what I would say. And what I'm showing up here is from an incubator and investor from a few years ago, and this was their recommendation. So essentially, when you're thinking about a startup, they're saying you want to develop recurring revenue. And the way in which they encourage you to develop recurring revenue is by adding a disposable. And you'll see this throughout the health system. There are all these things that work really nicely, and you're like, but why do I need to throw this thing out after one use? And that's because it's been encouraged. It's the technology. It's the razor blade model of startup economics. So they give you this product for free, and then you pay an expensive disposable for the rest of its life. Good news is that I now have to reach into the Internet Archive to get this slide, so they've actually removed it from their slide deck because this is, I think this is coming out of UCSF, and UCSF, their health system specifically, is very forward-thinking when it comes to sustainable healthcare. But this is the mental perspective that a lot of people in health systems, in the health sector business side have, which is, how can we extract more money from it by selling into it? And I'm very interested in figuring out the opposite. So this is the very cartoony small slide of what Dr. Adut showed us a little bit earlier. So this is healthcare's vicious cycle, which is that we have sick patients, we consume a vast amount of resources, we pollute, and then we cause more sick patients. And so we've got this very vicious cycle that we need to address. And something that Jonah talked about earlier, and something that I'm still trying to, so I have both a research and an advocacy side. I'm trying to figure out how to wrap this into the advocacy side, is that I'm going to talk a lot about climate change, but probably the more important conversation about here is resource utilization and environmental degradation, which we're also contributing to tremendous amounts to. But the burden of research, the amount of research that I can really present solidly, ends up on the climate, the carbon side of this. So this is an article. Jody Sherman is also an anesthesiologist. She's a senior author here. And then Matthew Eckelman, she's out of Yale, and then Matthew Eckelman's out of Northeastern. They're the people who did a lot of the legwork on this. They looked at the entire health sector, and they came up with carbon dioxide estimate emissions equivalents. So 8.5% of the US global emissions come from the health sector. I always need to wrap my mind around megatons and things that are like that, especially when we're talking about gases. But to put it in perspective, that's the same amount of emissions as Indonesia, the entire country. Indonesia has about 270 million people at the last estimate. So countries essentially the same size as the US, our health sector emits the same amount of emissions. So it's a lot of emissions. When same authors looked and tried to apply this to what it meant in terms of health, they estimate that between 50 and 100,000 deaths are unnecessarily caused by health sector emissions and pollution. Well, that's the full statement. 50 to 100,000 deaths are caused by health sector emissions and pollution. That should be staggering again, because that's a lot of deaths. If you compare that to leading causes of death in the US in 2017, that makes it the 8th leading cause of death is health sector pollution. And clearly there's economic modeling that goes into that, and there's estimates based upon quality adjusted life years. But it still should make you think, are we really killing 50,000 people because we're polluting that much in the health sector? We know we're polluting a lot. Like, you don't need to go any further than the loading dock to see how much garbage we make every year. And that's just one very, very visual, very physical representation of it. So here's more into that article. This is where we get deep into the climate side of things. So Scope 1, Scope 2, Scope 3 emissions. So Scope 1 is the pollution that's actually occurring on site. That's about 8% of emissions from the health sector. Scope 2 is the electricity that's used to power all of these systems, companies, et cetera. That's about 10% of emissions from a health system. Scope 3 is everything else, and that's really what we're talking about here when we're talking about supply chain. And of course, Scope 3 is so much more complicated than just the supply chain, but we're going to use them synonymously right now. So 80+% of health sector emissions are coming from the supply chain. Again, most of the supply chain is to feed the beast, which is the health system. So we've got health systems that have 50, 100 hospitals these days, and they are huge purchasers of all of this. And my hope through advocacy is to try to get them to start thinking differently. Start paying attention to the impact their pollution is having on the patients that they're supposed to be serving. This was a very, I would say, momentous occasion in the climate health world, which is when we had an article simultaneously published in 200+ medical journals throughout the world, including the New England Journal, which is probably the top medical journal in the world, the BMJ, which is another one of them, the Lancet, and then East African Medical Journal was one of the lead authors on it. They said, among many things, the greatest threat to global public health is the continued failure of world leaders to keep the global temperature rise below 1.5 degrees centigrade and to restore nature. So this was a message. This caught national, international press. It was received, it landed. And again, note the date. This is during a global pandemic, and we're saying that climate change, yes, is worse than COVID-19. So this got people to move. And these are some of the people that moved. So we've got the National Academy of Medicine created a climate collaborative. They're focusing on decarbonizing the healthcare system. You've got the CDC's paying attention. In HHS, you have the Office of Climate Change and Health Equity was stood up. It's still not really funded, but it's stood up, and there's a couple people, some lights are on. Healthcare Without Harm is an institution that's been around for at least 10, 15 years. They've been doing wonderful work in creating a national and international work. You have radiologists. They actually had a conference that was focused on sustainable radiology, which I think is absolutely brilliant. That was like their national congress, national and international congress. That was the leading theme on it. Society of Critical Care Medicine, Dr. Kyle Enfield, not here, intensivist ACMO at UVA Health. He was the speaker. He was not the speaker. He was the interviewer on there, but he led that without a doubt. He's very interested in this. What else do I have up there? I have healthcare executives, and then I have Colin Cave. He's out of California, and he's working with the AMA on this. So you all of a sudden basically galvanized a lot of support. We went from sort of like a bunch of people, specifically Dr. Dutz is one of the first people in the nation to be really elevating this topic, to all of a sudden you had a movement was forming. The acronym that you don't see up there, which is a little bit unfortunate, but I'm going to dig deep into that, is CMS, which is the only acronym that really matters when it comes to funding in the hospital. So if you have CMS funding, you have a hospital. If you do not have CMS funding, you do not have a hospital. They are one of the biggest payers. This is Medicare and Medicaid. So where are they when it comes to health? And this was buried in about 1,000 pages of documentation that was published last year about this time. So you can see in red, I've highlighted the big pieces here. I put this up here, and this is this busy slide because this is what matters. This is the future. If this is what CMS is making as a synopsis, this is probably what everyone else is going to be paying attention to. So big pictures is that the comments almost uniformly embrace the importance of setting goals for reduced emissions and increased climate resilience. As Dr. Dude said, it's hard to not talk about politics when you talk about this, which is just dumb. It's really just dumb that this is politicized, but it's been politicized. So CMS runs by, there's laws, there's executive actions. Executive actions are really what will guide whether or not decarbonization of health system bubbles up. But it does seem as though it's prepared to do that. What people were asking for was more data to understand threats and health impacts. They were looking for operational and clinical improvements, standardizing measures and measurement frameworks, emergency preparedness, and then engaging supply chain stakeholders. That's the top tier message. For a brief heady moment, the Joint Commission, which is who accredits for CMS, put in what looked like a proposed mandatory requirement for environmental sustainability with the hospital decreases greenhouse gas emissions and waste, full stop, as being the standard. This only lasted about 3 weeks, and they got feedback from what has been reported out as senior executive leadership, who basically, and I quote from Clean Med, one of the Joint Commission people, they said they were told to stay in their lane. I can't think of a more appropriate lane for for an organization that accredits health system than helping to protect health. But, this is my opportunity to publicly, put that argument out there. Either way, they supposedly are going to create an extra credit or a certification process for sustainable health systems. So TBD. I also want to talk about the AHRQ because when we're talking about funding, this is the only organization in the HHS ecosystem that has really come out and really put something in here in terms of sustainable healthcare and decarbonizing the health system. These are their priorities. They put this measure out. Again, I'm going to mention Jody Sherman was a key person doing this. She's everywhere when it comes to this. You can look at this article if you want, small letters on here, but basically energy, transportation, anesthetic gases, that's the connection with anesthesia, pharmaceuticals, medical devices. This was put out in January. This was the HRQ call. This is a real funding request. This is real money that they're talking about. And here are their principles. So measuring and reducing carbon footprint, increasing resiliency, and addressing equity. Specifically relevant to what I'm here to talk about and what my personal passion is for interest, I'm interested in figuring out how we can change the healthcare system to be a driver of decarbonization, both inside of the health sector, as well as taking the giant amount of money and resources we have in the healthcare sector and driving it into other parts of economic sectors. Specifically with the assistance of the Environmental Institute and the funding, I am working on that Green Star, which is trying to understand how to measure the carbon footprint of healthcare systems. This is simply not done well, and until we get some data to start off with, we're really just sort of playing around in the dark. So working with the Environmental Institute, working with a company called Row Impact, and then Venkat, a wonderful medical student sitting in the back row, working with me as well as a couple other people. So if you want to join that, we bit off a lot here. So happy to have any participation in there. And then I want to leave you all with this. So we create 37 billion tons of greenhouse gases globally. 5.6 of those tons come from the U.S. Healthcare sector is 8.5% of the U.S. healthcare, of U.S. greenhouse gases. Scope 3 is 80% of U.S. healthcare sector. So when it all boils down, 1% of global emissions are coming from essentially the supply chain of a health sector in the U.S. Here are research opportunities. I've just put up, this is brainstorming. I'm running way over time. And what I want to show here is this is UVA Health. I'm representing it. I don't think there's a ton of clinicians in the audience right now, but there's a ton of clinicians in the audience that are in the health system over there that are very interested in being involved. So if your research seems to like it could really benefit from a clinician of some flavor, let me know. I can probably find that person. And if not at UVA, I'm almost certain I can find that person somewhere in my network. So please, I'm really excited to have you all here. I'm offering myself as a conduit to the health system. I've learned there's quite a barrier, and I want to try to break that as much as I can. Thank you.